Hello everyone. In this video, I will be presenting an evaluation of the social marketing and social mobilization project by Eric Phil Estrada, titled The Challenge Initiative or TCI. So to guide this assessment, I will use the CAPES framework, which examines five key components, which are the community relevance, audience engagement, partnership strength, enabling environment, and sustainability. Rather than assigning ratings, so this evaluation will focus on how these components interact to support the campaign's longevity. So each element is interconnected, and the absence of weakness of one may affect the initiative's ability to sustain its impact over time. Through this approach, I will analyze how effectively the campaign contributes to meaningful and long term social change. The first component of the CAPES framework is community relevance. So the challenge initiative addresses the issue of rapid urbanization in Africa and Asia, which disproportionately affects the health of the urban poor. So this includes limited access to family planning services and reproductive health care, which contributes to higher maternal and child mortality rates. So the campaign focuses on providing voluntary and rights-based family planning and adolescent sexual and reproductive health services. Because of this, I would assess the campaign as having strong community relevance as it directly responds to the needs of the underserved urban populations. The second component is audience engagement. So the campaign uses multiple strategies such as door-to-door counseling, intergenerational dialogues, and digital platforms like the TCI University to engage its audience. I think the key strength is the use of trade social mobilizers who conduct personal outreach within the communities. In addition, the male engagement campaigns and youth dialogues help address cultural norms and stigma related to reproductive health. However, I think one area for improvement could be expanding digital access for communities with limited connectivity. Overall, the campaign demonstrates effective audience engagement as it combines interpersonal communication, community participation, and digital learning tools. The third component is partnership strength. So the challenge initiative involves collaboration between global organizations, local governments, and health institutions. So these includes the Gates Institute, Zuba League Family Foundation, Department of Health, and other international partners. So these partnerships are essential because they provide technical expertise, funding, and local implementation support. Because of this, the campaign demonstrates strong partnership strength, highlighting the importance of multi level collaboration and social mobilization. The fourth component is enabling environment. So TCI works closely with local government units, including mayors and city health officials, who are responsible for planning and funding health programs. So this ensures that family planning services are integrated into local policies and health systems. So the campaign's business unusual model encourages cities to commit to their own resources before receiving support. This creates a strong enabling environment by promoting ownership, accountability, and policy and integration. So overall, I think the campaign operates within a highly supportive and local driven enabling environment. Now, the final component is sustainability. So, TCI emphasizes long term impact through its graduation model, where cities take full ownership of the program after building capacity. So, cities typically work with TCI for about 3 years before becoming self sufficient. So, this approach ensures that programs continue even after external support ends. As of 2026, the initiative has reached millions of people across more than 200 cities worldwide. Based on this, the campaign demonstrates strong sustainability as it builds long-term capacity and institutional support. Overall, based on the CAPES framework, the challenge initiative demonstrates strong elements of social marketing and social mobilization. It addresses a critical issue, uh, engages communities through participatory strategies, and builds strong partnership and promotes long-term sustainability through local ownership. I think one area for improvement could be expanding digital accessibility to ensure inclusivity across all communities. This campaign highlights how combining communication, community engagement, and system level support can lead to sustainable social change. Thank you, Eric Estrada, for presenting this campaign. Your presentation highlights the importance of participatory approaches, strong partnerships, and local ownership in addressing complex social issues. I would also like to thank my classmates and professor for viewing my evaluation. I look forward to seeing how similar initiatives continue to empower communities and improve public health outcomes.